Harshavardhan, Dr. Subhash, for giving me an opportunity to present some of the my work. And obviously, you people are giving your precious time, so there will be something to take back home. Worked really hard for this to make it very interesting. Next half an hour, I'm going to be very sure that this is going to be just like a typical Bollywood movie. Laughter, emotions, comedy, everything will be there. So I hope you'll be very much interested in seeing this. So our tributes to the father of plastic surgery. Obviously, Shiva is considered the first plastic surgeon who has transferred his son's head, that's Ganesha's head. So he's considered as a father of mythological plastic surgery. And Shushruta is a father of ancient plastic surgery. He had devised nose reconstructions in that era, like 2000 years back. Plastic surgery, plastic and reconstructive surgery is considered as a problem solving branch. If there is a problem, like we usually have a association with almost all the branches of the medical sciences. Like we deal few with pediatrics, we have our associations with END people, ophthal, uh, prosthodontist, endodontist, everyone we have a dealing. But general public, they feel that plastic surgery is something like this. So if plastic surgery was this easy, we would have not read for 15, 16 long years. This is never like this. It's never like this. Even if we bring and put the tissues, it's never like this. The general public has a perception something like this. So it's not that this easy. So what exactly we deal with? We deal with the soft tissues and structures related to soft tissues. Something like we deal with the muscles, we deal with the artery, vein, nerve, we deal with the facial bones which are soft, we deal with the hand bones, we deal with the foot bones. So these are the major structures. We don't deal with lung, liver, heart. We don't deal with that. We don't deal with trachea, spine, and all. We don't deal with that. So these are the soft tissues. We deal with hand surgeries, facial soft tissues. We deal with the foot. Obviously, burns, entire burns, as we specialize and give the best results with the least scarring. These are the various subspecialties like hand and foot surgery, microvascular, reconstructive, pediatric burns, cosmetic, craniofacial, maxillofacial, and there are various other subspecialties, and it's still evolving. So the entire plastic surgery is based on principles. We don't have organ specific. We have principles, and those set of principles we follow in treating almost all the diseases. So the first principle, I will tell about few of the principles and show you the case scenarios, and from there you can take forward. So observation is a basis of surgical diagnosis. Observation is very important. Like the moment you observe, you should have the analytical power to understand what is the disease or what is a lesion and how to proceed further. So these are the lesions. The people come something like this, and these are CA of the lip, needs a wide local excision followed by reconstructions. These are the basal cell carcinoma lesions on the face. Various lesions, there can be bigger lesions, smaller lesions, need wide local excision, reconstruction with the various kind of reconstructions are there. So here we did a advancement transposition flap from the uh, glabella region. Other principle is respect the tissues. This is very important. I always tell the primary reason why we have the least scarring is we respect the tissues. The handling of the tissues is very minimal. I have seen people applying alice to the skin. I have seen people applying artery on the skin, holding, crushing the skin. We never do it. If I see anyone doing that, I just hit them. It's never done. I mean, that causes more of scarring. So respect the tissues. Handling of the tissues is very important, and that's where the outcome comes. I'll show you a few of the examples. These are the extensive facial injuries where we had a penetrating injuries. So we did a repair under general anesthesia, and these are the final outcomes. This is a dashboard injury. Patient was traveling in a car, had a road traffic accident, extensive facial injuries, and this is the final outcome. Another facial injury, extensive deglowing of the right cheek and forehead, did a extensive repair, repaired all the tissue structures, anatomical structures, everything, skin, soft tissue, muscles, artery, vein, everything was repaired, and this is a final outcome. Another patient with a injury to the face, parotid duct was injured. The advantage in these patients is once they come immediately, the injuries are fresh, the soft tissue injuries are really fresh, and once you do the repair in the fresh wounds, the results are amazing, very nicely results. In fact, sometimes you cannot even understand that the patient had an injury. I will show you some of the images in the further due course of time, and these are the various facial trauma injuries. Bone was fixed and the soft tissue injury was repaired. Avulsion of the ear, the patient had avulsion, this completely ear was avulsed. Under general anesthesia, this was repaired, and we gave a near normal appearance of the ear. Malignant melanoma appearing on the nose, we did a wide local excision and followed by a bilobed flap and covered the defect. This usually, after once the sutures are removed, we give something called as scar therapy. Once the scar therapy is given, it's very difficult to make out that he has underwent surgery. In few of the cases where there is extensive scarring, only those patients we can make out there is surgery. Otherwise, most of the patients, they don't even have a linear line. The other principle is replace like with a like. It's just like something like a jigsaw puzzle. So this patient had a loss of a upper lip. Very recently, they had brought upper lip as well, the cut part. Had an assault due to the financial trouble in the family. The other opposite person, he bite his upper lip. So they also brought this upper lip. They wanted me to replant that, but it was completely contaminated. The vessels were not available for us to replant. So then what we did was we did a full thickness skin graft from the ear, and this was the final outcome. Can you make out he has underwent any surgery? So replacing like with like is very important. The tissue what we have to represent, like the skin of the upper lip almost matches with the skin of the post-auricular region. That is where we have to take the skin. Another patient, this patient had a trauma to his eye, was sutured elsewhere by someone else. So you can see a clear mismatch. You can see here the clear mismatch, right? Imagine an 25-year-old, he's an engineer, unmarried, goes to see a girl. If his eyes are something like this, how it appears? So many of the times I have seen in casualty, immediately the patient comes, I always tell, don't remove the hairs, don't ever remove the hairs. In my practice, I don't remove the hairs, especially the eyebrows, never remove it, because eyebrows are very important in expression. If somebody doesn't have an eyebrow, imagine how they are going to express. There are many functions of eyebrows, and eyebrow is the only hair in the entire body which grows very slow, very, very slow. So never ever remove the eyebrow. So he came to us the very next day. So we did a repair. From here, we went to here. So now you can see it's aligned, completely aligned. We use a micro switchers. My switchers are not visible. Once the switchers are removed on 10th day, we start a special cream gel for next 6 months. And with that, almost a very faint linear scar will be seen. Another trauma patient, extensive trauma to the left cheek, had a deglowing of the left cheek, repaired using micro switchers. This is a final on table. World is very complex actually, so we are going towards a very fast moving paced economy world, and many things are beyond our control, right? Many things are beyond human control. So this was a 38-year-old lady. She was working on a rotating machine, like Rashi machine. So she was working on that. Her hairs got entangled in the rotating blade. The hairs along with the scalp, it got avulsed completely. And she came to us. This happened morning 11 o'clock. Usually this work starts in the morning. She came to us at 5 p.m. in the evening. That day we were operating somewhere from morning 7 o'clock. We did some 6 cases. Morning 5, evening 5 o'clock, we were about to go home. This patient came to casualty, and then ahead of us we had many things. First she was taken to a local hospital, first aid was given, then she came to us. Probable cervical spine injury was suspected by neurosurgeons, and obviously nobody keeps money and have these kind of injuries. Nobody has a money and goes and hits a truck or something like that. So next was this. We had many things in our mind that was going on. One side we had to restate, prepare the scalp, anesthesia of the patient, GA, dissect the vessels, artery, vein, nerve, suture the scalp, vessel anastomosis under microscope, dressing. Total duration would have taken somewhere around 8 to 10 hours. So if we start at 6 p.m., probably it would have gone up to 4 p.m. So this was at one point. And other side, we have to look at a broader picture, very broad picture. A 38-year-old will get back her own scalp. Hairs will be natural. Body image maintenance. She will have a society will accept that, and no need of wigs. If we replant, there is no need of wigs. Husband and son will get a mother and wife back, and moreover, the family will ever be grateful to you. So these were the points. If we don't do the surgery, this would have been the possibility. These are from the other studies where we have seen from the other experiences. If you don't attempt a replant, the patient will have a raw area that needs to be grafted, followed by a wig appliance, and lifelong she has to wear a wig. There will be some amount of discharge, hypersensitivity, those all things will be there. So we started morning 3 p.m. We prepared the scalp, and we replanted at 3 p.m. The entire set was ready, and we released the clamps. Blood started flowing inside the scalp. Believe me, at 3 p.m. there was complete joy in the operation theater. The moment the clamps were removed, the scalp became pink, and we cannot express what was the happiness among the team members of the operating team. So it was not just the scalp survived, it was the life that was reconstructed following this operation. And this is the right side. What you see is a pre-injury photo, and the left side what you see is after reconstruction of the scalp, and she had almost near normal appearance of the scalp. So what was the possible responsible for this result? Transfer to appropriate center, good resuscitation and early shifting to operating room, good resources and infrastructure. This is very important. Like we cannot operate in a resource constrained centers. Operating in a good resource center is very important. Expertise in handling these kind of surgeries, rehabilitation, and attitude is a very little thing that makes a big difference. If at 5 o'clock, if we had told that we had a long day, let us not do it, we have not got this result. So there is one important, very important, if you have not gone through this book, or there is even a documentary on Apollo 13 failure. The documentary is named as Failure is Not an Option. The same applies in our plastic surgery, especially in reconstructive microsurgery. So failure is not an option. If there is a no bleeding to the blood supply to the free flap, or there is no blood supply to the replanted scalp, we don't stop at that. We have to again find what is the best option. Vein graft. We have to dissect the normal vessel, because the one body part is gone, right? We don't get another body part. So failure is not an option. If people have not seen this documentary or not read this book, it's very important, very amazing book. You can read. It's about Apollo 13 who went for a moon landing. They had a technical glitch and they could not land on the moon. How uh, the commander from the NASA, they brought back to Earth. That is about this book. So another patient, we had a Bulgor injury. This was in Gulbarga. The entire scalp was, I mean, the entire face was deglowed. Her facial nerves was cut, the facial muscles were cut, facial artery was cut. So everything was cut on one side. So she came like something like this, and we took her immediately to the OT. We resuscitated her. Then this was the final repair. All structures were repaired, and this is a final appearance after 1.5 months. The patient is back to her family, very much laughing, very much happy, almost near normal, except that one faint scar. The next principle is the making of the plan. And just not making the plan, you should have a backup plan for all your surgeries. So these are the scars on the scalp. The scar doesn't have a hair follicle, so they don't grow the hair. This patient was ashamed, so we had to do something called as either a tissue expander or using the existing scalp, we have to remove the scar. So we excise the scar, we can use the tissue expanders, we can expand the normal skin, excise the scar, and give a near normal appearance, very much acceptable. Another patient with a scalp scar revision, this requires an extensive planning. Like once you implant, how much it has to be enlarged, how much scar has to be excised, how much flap is needed, and what is the final appearance. That planning has to be very important, and this takes a lot of amount of your energy, time. So another patient with a scar alopecia, tissue expanders are placed in, and this is a final result after the expanders are removed and flaps are advanced. This was a very interesting patient. So we had a young girl who was traveling for a family trip, had an accident, whole family had an accident, and she was treated elsewhere. She came something like this. The entire scalp, this area was necrosed. So we did a debridement, we did a advancement flap, we covered it totally. This was a post-operative on-table image, and after suture removal around 14 days, this is how it looked. She came to meet us probably after 1 year, and that time this was the final appearance. Now she is a air hostess working for one of the major airlines. She's very much amazed. She is back to her normal. So this is what can be given. Planning is so important that contour deformity, something like this. He had a facial injury, had a depressed frontal bone fracture. Contour was not normal. So we used a titanium implant. Our prosthodontic friends gave this implant, and we did a prosthetic contour correction of this. We used a bicoronal incision and placed the implant, and this is the final appearance. Eyelid reconstructions, patient having these kind of injuries following trauma needs to be accepted by the family and the society, needs an eyelid reconstruction. Something like this. This needs a periorbital reconstruction followed by prosthetic eyelid. This is a very interesting patient. So when I came to Gulbarga back from US, so this was a 23-year-old female. She had a ear infection in her childhood, so she lost her ear lobule. Patient, as usual in our place, they are negligent. They don't bother unless it's till wedding. At the time of wedding, many patients, many prospective bride grooms, they came, they saw, they said, ear is not normal, we don't want to marry. So then they remembered that we need to approach some doctor. They came to us. We did a reconstruction. So this is after the reconstruction. Parents were very happy. After 6 months of this reconstruction, they came to us again. This time they came with a wedding card. Today the couple is very happy, leading a very happy life. Here they are working in Shabad Wadi only. So this is how we change the life through a small reconstructive surgeries. Another patient with a loss of a helix following the RTA. This was the helix was reconstructed using a advancement flaps. Another patient with the loss of total ear. The total ear was reconstructed in a single stage using a temporoparietal fascia. This is the reason planning is very important. I spend a lot of time before I operate any patient. So I spend a lot of time planning. I take CT scans. If I need help, I use my other colleagues. Sometimes I use prosthodontic colleagues' help. I use the help of a radiologist to come to a conclusion where we can give up better results, better outcome, and better acceptance by the society. These are electrical burns. Patient had a electrical burns. He held the wire in his mouth and cut the wire. So he had a burns. We did a advancement flap and reconstruction. Patient had a tumor, excision followed by reconstruction. The another important thing what I want you all to take from here is handling of the tissues. You should always handle the tissues just like how you handle the newborn. Tissue respect, again the same thing. Handle, you don't apply the harsh Alice forceps on the tissues. You should not be very harsh on let it be bone, let it be soft tissue. You should be very gentle, very gentle. Minimal handling gives very excellent results. That's what I want to convey. So cleft lip repair, very commonly done. These are the pre-op and these are the post-op results. Cleft lip, again these are the final results, almost near normal, non-visible scars. Most of these patients lead a normal life, even you can't understand that they had a surgery. Another patient with a cleft lip repair underwent at the age of 5 months. Cleft palate repair, almost near normal, we do usually at the age of 9 years. Central craniofacial clefts operated, and this is how the best, but these requires multiple stages, like at the age of 13-14 they need a telecanthus correction. Multiple stages are required. The most important principle what needs to be followed, in fact I tell my most of the success goes towards this only. Do something positive. You have to be a very positive person to get a very positive outcome. You cannot be just like a very rude surgeon and get a very good results. So always think positive. You have to think what best I can do for a patient, then only you get the best outcome in the patient. So at present this patient is something like this. You can see this is normal, right? This looks normal, but happy Diwali was not happy for many. 6 months back how she was, I'll show you. 6 months back she was something like this. So she came to us with a flower pot cracker injury on the face. She came something like this. She came to us. I convince like anything. My consultations are something like meditations. I take half an hour to explain them each and everything. After that, the parents were like, my neighbor said, don't do surgery. If you do surgery, her face will go. She will have scarring and all. They came back to us after 2 days. We did a debridement, we did a antibiotic dressing, we gave a multiple scar therapy, multiple everything, and this was the final result what we could achieve. So today she is going to normal school. She is doing almost all the activities normal. Neglected burns, these also require extensive planning. We have to be really gentle with the tissues. We can give a near normal appearance. Romberg's disease, where one side of the face is small, we do something called a submental artery flap. There are many methods like facial fat grafting, or we can do a muscle transfer. Many things can be done, and these are the final outcome. Another principle, important principle what we follow is steal from Sharon to pay Prakash only if Sharon can afford it. Sorry, Sharon. So in plastic surgery, if I have a defect somewhere, I have to steal from someone to pay the defect if only the from where I can take can afford it, right? If I want to pay Prakash, I have to steal from Sharon. For that, Sharon should have equivalent or more than that, right? So I'll show you examples. So this patient had a basal cell carcinoma. His entire nose was eaten by that 65-year-old gentleman, and his granddaughter was not going to him. That was his main problem. Other than that, he was not having any pain. He was okay with the nose, eaten nose also. But his granddaughter was not coming to her. That was his main problem. So patient was hiding with his clothes, avoided going outside, socializing. Family disowned him. He was expecting a near normal nose and wanted to play with his grandchildren. So what we did was we did an extensive planning. We did an extensive studied where the cancer was, biopsy was done, diagnosis was established. Then we did a forehead flap. Forehead flap was planned. This is a forehead flap, and this area was grafted. Uh, this was done obviously in stages. 3 stages was needed. A series of operation was done to achieve a good result. Reconstructive surgery is one of the most satisfactory job, and results are seen and appreciated. We had a almost near looking nose. This was his final appearance. We used a ulna for dorsum of the nose to give a support. Forehead flap was used for reconstruction of the nose, and you can see the forehead. This is Sharon, who can afford to lose the skin there, and a very well reconstructed nose. Another patient, we had a trauma to the nose. His right ala was lost. We did a forehead flap. You can see this is a scar, very linear scar, and well settled forehead flap, near normal, married, well settled now. Another patient with a basal cell carcinoma, forehead flap, forehead scar, well settled, very happy now. So here the important thing is steal from the places where it can afford. That's a very important thing. Another patient where he had a traumatic defect of the lip, advancement flap, and you can hardly make out that this patient had any surgery. Another patient, nasal defect, forehead flap, very faint line, lower eyelid defect. Patient had a RTA. We used a nasal label here. From here, we have taken one faint line. This patient, this scar could have been. I mean, this part of this cheek could afford a loss of skin, and we reconstructed the lower eyelid. Another patient, traumatic ear defect. We took a flap from here, post-auricular region, reconstructed the helix. Helical reconstruction was done. Most important, my suggestion to everyone, it applies to everyone probably who is a doctor. You have to be very comfortable while operating. This is very important. You cannot operate in a stress. You cannot operate in a very deformed position, in a very resource constrained, always nagging, always scolding. You cannot. You will not be able to give a good result. So always be very comfortable. I always operate in a operating theater where there is a good lighting, good cautery, good table, good assistant, stress free, and I literally enjoy operating. In fact, I sometimes I play a very light sound music, and I enjoy that. So another basal cell carcinoma, the patient had a wide local excision, reconstruction with the glabellar flap. Patient with the basal cell carcinoma. So ultimately, what I want to say is there are multiple options. If you should always have a multiple options. If this doesn't work, what is the other option? For me, if this flap doesn't work, there are many times I am not God, right? There are complications with everyone. So if this flap doesn't have a blood supply, this may become a black. So what is the other option? I use something called as nasolabial flap. I can use a cheek flap. I can use a forehead flap. There are multiple options, and always you should have a lifeboat. Whenever you are traveling in a big cruise, you will see lifeboats, right? Those are used for the emergency, something like that. We also have a lifeboat. Always that's going in our mind that there has to be something as a secondary plan. Eyelid tumor reconstructed with the advancement flap. Cancer reconstructions, even though my work for cancer is very less. This was a 50-year-old female, had a oral cancer. The part of the jaw was removed in the cancer. The cancer surgeon had to remove the jawbone, and after this, most of the times they just leave it like that. Sometimes they ask for the reconstruction. So imagine a person doesn't have a jaw, half of the jaw, and not able to eat his favorite food. Life would have been very horrible for that. So what we did was we used her leg bone, fibula we used, we recreated into a jaw, we fixed using the plates, and skin was closed, and this is a final appearance after the jaw is reconstructed. This is a pre-operative and this is a post-operative. Very much normal. Our dental friends later on did a implant on her, and she has a normal jaw now. Another patient with a CH reconstruction done with a local flap. With this, I'm almost coming to an end, but few points, more points about our practice, where the healthcare in Gulbarga is going. And I always say people who really they are close to me, they know that I don't sit idle. Never, never. Probably in last 15, 20 years, I never had a time when I had just sat. We have to really work hard, because we are in a country like India where we have to really work hard to have a bigger economy, bigger. We have to do something big for the country. And I strongly believe these words of Steve Jobs, that you should stay hungry and stay foolish. My long term, what I see is Gulbarga as a health hub. Medical tourism has to boom. I get few patients from Middle East, very few patients from UK, US. The people who are in Gulbarga who have gone there, they come to us for surgery, because obviously long waiting period, long treatment, everything. Work ethics has to improve a lot here. I somehow I feel our work ethics are really not up to mark, so it has to improve. And my humble request to everyone, you please tell your all employees, the friends, relatives to buy a health insurance. Yeah, we have to buy a health insurance. We cannot just ask discounts, go request for the discounts. Healthcare will not improve unless until you put money in that, right? If you plant a tree, you have to water it, then only it will grow. Health industry also needs money to grow, so we have to invest in healthcare. If you pay to a hospital invest in a infrastructure. Hardly few hospitals they invest in some other things, but most of the hospitals they will improve. We can conduct CMEs, we can improve the healthcare. That's why I request, buy a healthcare. 5 lakhs, most of the health elements can be addressed in Gulbarga, so at least that much is a minimum amount. So health tourism has to be improving, and I know many of you guys are doing excellent job. Already we are getting many patients from all other parts of the country for health problems. Advances what we wanted to implement is, actually I had planned this, while dressing we should distract them, right? Probably you people can implement this using a VR system for deviation while doing a dental treatment. And talent definitely get recognized, it cannot be hidden. So recently, Bill Gates came to India. So he went to Nagpur to meet this guy, Dolly Ki Thapri. So he's Dolly. So he's very famous on Instagram. So he went to meet him. If you have talent, definitely it will come out. There is no need to be like, I have talent, nobody appreciate you. But keep doing working, keep working. It will definitely come out. It's just matter of time. Practice, practice, practice. Precision will come with practice. Results will come with practice. You have to know that what cases you have to choose, what cases needs a teamwork. And today morning only I was saying, uh, competition is for losers, collaboration is for the winners. If we collaborate together, we can do so many miracles. In fact, whenever I do a keloid excision, I always ask my prosthodontist friends to give a pressure therapies, pressure clips, and artificial ear. We are actually many patients. We request them like we can do a artificial ear implants or prosthesis. Some patients they get ready, some patients they don't get ready. By collaboration, obviously we can improve. It's the entire healthcare will improve. Everyone will get benefit. So with these few words, I thank IDA Sun City for giving me opportunity. I thank Girish Katti sir, Sharan SK, Sharan Prakash, Harshavardhan, and Dr. Subhash for giving me this wonderful opportunity. I thank all the audiences for patience hearing. If you have any doubts, I would be very happy to take them. Thank you.